Good day, everybody, and I'm just waiting to get everybody in from our online audience. Firstly, welcome to everybody to our EcoFoodSystems Project webinar today. We're delighted to have an online audience from around the world, particularly from Ethiopia and also Vietnam, which are two of the project countries of which our project is focused on. My name is Charlie Spillane. I'm a professor at the University of Galway in Ireland, and I'm the leader of the EcoFoodSystems Project. Our project is a project that is funded by the European Union and the International Fund for Agricultural Development, and the real goal of our project is to conduct research that would enable transitions to diets that are healthier, more sustainable, and also more affordable in city regions. And we have a particular focus on two city regions, Addis Ababa in Ethiopia and also Hanoi in Vietnam. So we're really delighted to have everybody here today, and also to have our distinguished and invited guests, whom I'll introduce in a moment. But just in terms of how we organize ourselves for the webinar, I should say that this webinar is being recorded and will be uploaded to a YouTube channel. And also, during the process of this webinar, if any of the online audience has any questions or comments, please post them in the chat. We'd really welcome your feedback. We're going to try and run this webinar in as interactive a manner with our online audience as we possibly can. So what we're going to do for the webinar is, firstly, we're going to have a presentation by an EcoFoodSystems researcher, Dawit Chekol. I'll introduce Dawit in a moment, and then that will be followed by our invited panelists, and I'll also introduce our invited panelists at that point. So we'll have a Q&A with the invited panelists, and then we're going to do an interactive exercise with the online audience. So I guess be prepared for that, and then we will also have a Q&A session where the online audience can pose questions through the chat to the speakers today, the four speakers today, and then we'll look at what the response or the findings, let's say, of the interactive exercise with the audience are, and then we'll wrap up. Okay, so at that, I'd like to really just thank everybody for taking the time to join us today, firstly, and then also to thank our speakers, our invited panelists, and also Dawit. And at that, I'm going to hand over to Dawit to give us a presentation on some work that he's been doing within the EcoFoodSystems Project, which is focused on affordable and healthy diets in Ethiopia. And I should say that Dawit is a PhD researcher, registered at the University of Galway on the EcoFoodSystems Project, and seconded from the Ethiopian Public Health Institute, and he's a specialist on diets, public health, and nutrition. So over to you, Dawit.
Thank you, Professor Charles, and hi everyone. Today, I will present my research finding on rising healthy diet costs, affordability challenge for urban laborers in Ethiopian cities, Bahar Dar and Hawassa. Next. So to start with, the research question is, can poor urban daily laborers afford healthy diet, and how much does it cost? And what proportion of the daily wage do urban unskilled daily laborers spend for a healthy diet? So understanding access to healthy diets is a key to ensure sustainable and nutritious food forward. It requires, understanding production, availability, and affordability challenge in the country. So according to the recent definitions by WHO and FAO, to be healthy, diets should be adequate, balanced, moderate, and diverse. Food-based dietary guidelines are the ideal policy tools that can guide consumers, towards, choosing healthy, and also for shaping the food environment. They are essential tools. So the goal of this study is to determine cost and affordability of healthy diet for unskilled manual laborers in Bahar Dar and Hawassa cities, Ethiopia, analyzing their daily wage spent on food for the study period from April 2022 to March 2023, a one-year study period. Next. So for this study, we have used two data sources. One is the quantification of the Ethiopian food-based dietary guidelines that are launched in 2022, and now it's on implementation. The second data source is the retail monthly food price and wage prices as well from the Ethiopian Statistical Service. So to start with the first data source, the table here is quantification of the Ethiopian food-based dietary guidelines, having 8 food groups and 12 item healthy diet baskets targeting 2,330 kilocalories per day per person. So the first column shows 8 food groups where animal source food groups are disaggregated into 2 as meat, fish, and egg, as well as dairy, and fruits and vegetables are disaggregated as fruits and as vegetables. The second column shows the number of items that are needed per day from healthy diet basket. For example, from starchy staples, 2 items under this food group are needed, as well as from fruits and vegetables, 2 and 3 items respectively are needed for a healthy diet. For other food groups, the remaining food groups, 1 item for each is enough, as per the healthy diet basket rules to be healthy. And the third column is all about the recommended intakes, the gram amounts that are recommended by the food-based dietary guidelines for a healthy person. And the last column is an energy balance targets in kilocalories per day in the least cost healthy diet. So to start, what the cost of a healthy diet is. Cost of a healthy diet is the cost of least expensive locally available foods to meet the requirements for country set BDGs per capita per day for a representative person with an energy balance at 2,330 kilocalories per day. This is a requirement for an average person. Next. And the second data source used was the food price, as well as the wage per day of unskilled daily laborers. These unskilled daily laborers can be construction workers or workers that are, on unskilled jobs, just like construction and the likes. So data specific to Bahar Dar and Hawassa markets is extracted from the national data, which the former CSA and the now ESS collects monthly. So from 21 markets from Amhara region, where Bahar Dar city is located, and from 31 from the former SNLP region are extracted for Hawassa market. Next. So the entire methodology is following up cost of a healthy diet matrix by Tufts University, as well as the data codes are also used to customize to these specific markets, Bahar Dar and Hawassa, so that intra and inter food group diversities are observed, as well as availability of foods or food items in those cities, big markets are also observed. And daily cost estimates were derived from, as I have told you, monthly retail price data from these main markets. And affordability was calculated as the ratio that gives percentage of daily wage needed to be spent on healthy diets for unskilled manual laborers. In our case, wages used as it's a good proxy for the incomes of non-farm or poor urban consumers, as was outlined by the data. However, there are other income measurements. Next. So before going to results, I will characterize Bahar Dar and Hawassa cities in terms of their dietary pattern as well, locations and livelihoods. Bahar Dar city is in the northwestern location of Ethiopia. It lies in the Nile Basin surrounded by Lake Tana, and having a population of above 360,000. And the consumption pattern is mainly starchy staples as well as legumes, with a diverse agricultural practice in and around Bahar Dar, while Lawasa is located in different direction in the southern Ethiopia, with a population a bit higher than Bahar Dar. And urban agriculture and irrigations are practiced around and inside Lawasa with urban agriculture practices. Maize, vegetables, and fruits are grown there. So results has shown that cost of healthy diet per person per day in both cities was comparable. In nominal terms, it's 59 Ethiopian birr in Bahar Dar per day per person, and it's 58 Ethiopian birr per person per day in Hawassa. It's almost comparable. When we see the average daily wage for unskilled daily laborers in Bahar Dar is a 12-month average, it's 214.6 Ethiopian birr, while in Hawassa it's lower than Bahar Dar, it's 169.2 Ethiopian birr during the study period. Next. So when we see the cost trends over the study period, for example, in the left side, the Bahar Dar cost trends started from 45 birr per day per person and goes up to it reached to a slight declines in November and between November and December 2022, followed by an increase afterwards after December 2022. Actually, the seasonality is not actually distinguishable here in Bahar Dar. In the right side, when we see the cost trends in Hawassa, the cost trend is undefined and irregular. This might be due to many reasons, the market dynamics, and I will come maybe after regarding the food group costs, and maybe I will justify how it's so. Overall, cost of healthy diet is escalating in both Ethiopian cities. Next. So this slide shows a dual axis graph showing one is affordability trends in red lines, the line graph that is starting with the right side y-axis, and stacked bar graphs are also in the left side. So these are showing food group costs in each month for the study for the entire study. So in Bahar Dar, when we see the scenarios in Bahar Dar in the left side, there are daily laborers from their food budgets, highest peaks, in cost wage ratio or affordability in the start of the study was, above 32%, as can be seen in the line graphs, and goes declined until it reached its lowest point in March 2023. That was the end of the study in Bahar Dar. So at the end of the study in March 2023, 24% of their budgets of daily laborers are spent on healthy diets. But when we see on the right side the cost wage ratios of Hawassa, initially in April 2022, the cost wage ratio was below 30%, and it reached its highest point in July 2022, above half of their daily wages are spent on healthy diets. And relatively, it's in relative terms, it's more unaffordable in Hawassa than in Bahar Dar. Healthy diets are, affordable in Bahar Dar than Hawassa. Next. This slide shows food group cost shares. The food group cost shares between two cities is almost the same. As you can see, the largest cost shares are for animal sourced food groups. The ones in the donut chart in the red are meat, fish, and egg food groups, and the one in gray are dairy products. So they constitute the largest share from all food groups. Maybe the discrepancy between the two cities is cost of vegetables exceeds cost of fats and oils in Bahar Dar, but the reverse is true in Asa. Before getting to conclusions, list cost items were also identified as per the matrix. So the frequently selected list cost items with their respective food groups shown that almost similar between the two cities, but with regard to the two food groups, for example, from pulses food groups, veg is the least cost item in Bahar Dar, while beans are the first least cost items in Awasa in their rank. While vegetable food groups, for example, onion is least cost item in Bahar Dar, whereas beetroot is in Awasa. So this is clearly with respect to what foods are, produced in these respective cities. So before going to the concluding remarks, as you can see, costs are higher in both cities. Affordabilities are relatively it's better in Bahar Dar than Awasa, but this is using the daily wage. Assume hypothetical household on wage income. So if you have maybe 2 children or more than 2 children, things are becoming unaffordable for a household. This is for a single unskilled daily laborer. So it's been the costs are higher and affordability is becoming a challenge. Next. So the policy options forwarded are the following. The first one is strengthening social protection and income supports. This can be expanding urban PSMP in both cities to increase the incomes of these nutritionally disadvantaged consumers or population, and as well as enhancing the purchasing power of vulnerable populations. The second policy option forwarded is strengthening local food production price regulations. Cooperatives can be the best forward the recommendations to stabilize the inflations and the high food price costs, as well as subsidizing these small holder farmers is also a coping strategy. And the third one is promoting nutrition education and multi-sector collaboration, ensuring effective implementation of food-based dietary guidelines that are practiced as a pilot, but maybe scaling up the implementation, as well as synergizing the implementer, the frontliner implementer government sectors, specifically the Ministry of Health, Education, Labor and Skills, as well as NGOs, private sectors, and other community organizations are expected to work in collaboration. Next. Finally, I would like to thank my University of Galway, and EcoFoodSystems members, as well as the Ethiopian Public Health Institute and Sergawi from IFPRI. Next. Thank you for your listening. Thank you.
Dawit, thanks very much for a great presentation and a virtual kind of clap of hands I think from us all for your work on this topic. Clearly, the topic of affordable healthy diets is really one of the most prominent kind of issues in the whole area of kind of sustainable development, international development at present. And given the theme of today's webinar on how to achieve sustainable, affordable and healthy diets in city regions, it's really great that we have your presentation as an entry point, but also we have our three invited panelists who are all distinguished experts on this topic and recognized internationally. And so at that, I'm going to thank you, Dawit, okay, but don't go away, because if there are questions from our online audience to Dawit or to our panelists or to any of our speakers, it'd be great if they could pose those in the chat, because we'd really like to welcome the kind of thoughts and the comments of the online audience as much as our speakers today. Okay, so at that, I'm going to move on to our Q&A with our invited panelists. But before I do that, I'm going to just introduce our panelists in order, just so that we have an idea who we have with us. Okay, so I'm delighted to welcome Alemtsehay Sergawi. So Alemtsehay is the head of the Food and Nutrition Office at the Ministry of Agriculture in Ethiopia. She has over 25 years of professional experience in nutritional related development programs, particularly around nutrition sensitive agriculture. She's had many achievements over her career, but was really instrumental in establishing the Food and Nutrition Office at the Ministry of Agriculture, and also contributing to the development of national food and nutrition programs and policies, and also the nutrition sensitive agriculture syllabus for agriculture universities. So it's really great to have you here today, Alemtsehay, and so thank you for your time. Then also our second panelist is Andrea Cattaneo, who's the team leader of the flagship State of the World of Food and Agriculture report at the Food and Agriculture Organization of the UN. So if any of you, I'm sure many of you online are very familiar with the SOFA report, which comes out annually, and Andrea is responsible for compiling that wonderful document. Andrea is a senior economist at the FAO, and he's over 25 years of experience on economic issues relating to agriculture, food security, and climate change. And recently, he's been working a lot on migration, food loss and waste, resilience of food systems, and rural transformation. Prior to joining FAO, Andrea previously worked at the Woodwell Climate Research Center in the US, and also the USDA Economic Research Service and IFPRI. Okay, so thanks to you, Andrea, as well for your time. And finally, but last but not least, and we have Anna Herforth, who's the co-director of the Food Prices for Nutrition project at Tufts University, and Anna is a visiting associate professor at Wageningen University. But Anna really is a world kind of leader on kind of new thinking in relation to cost and affordability of healthy diets, and was a key player in developing the cost and affordability of a healthy diet indicator, which has been adopted as an indicator of food security and is globally reported in the State of Food Security and Nutrition and in FAOStat. Anna works extensively on the measurement of diets and on global food security, and is really all of our work is about action towards healthy diets and sustainable food systems, working with, amongst others, the World Bank, FAO, WHO, UN institutions, and bilateral government donors. So I'm delighted to have you all here today. What I'm going to do is I'm going to ask a question to each of our panelists, and then I'll move on to the next panelist. But I'll begin with you, Alemtsehay, with the first question, I think. So really the question that we've chosen to ask you is, like, what are the policy and implementation options that government has to improve the affordability of a healthy diet for the malnourished in Ethiopian cities, such as, for instance, Addis Ababa? And then how feasible are different options from a government perspective?
Hello, good afternoon. Thank you to give this opportunity. I will try to explain what the Ethiopian government what they are implementing in the nutrition sensitive agriculture, and also to increase healthy diet affordability, accessibility within the country. At the beginning time, the Ministry of Agriculture recently launched the revised agriculture and rural development policy. Within this policy, it's already incorporated the nutrition component. The previous policy, they didn't have any nutrition component, but the new policy already incorporated the nutrition component, and also the proclamation of the government given responsibility and role for Ministry of Agriculture to increase the production and the productivity of safe, healthy, and diversified production. So to meet this one, the Ministry of Agriculture restructured the structure of expertise from federal up to grassroots level. So we have ample expertise at grassroots level, that is development agents, focusing on the supporting the rural community, especially the farmers and the pastoralists and agro-pastoralists, how to produce agricultural products in safe way. Because most of the time they put ample or ban chemicals on the agricultural products, especially on the vegetable and some other cereal crops. So based on the recommendation to apply that kind of chemicals, the development agents are advised and give close education for them. Because one of the proclamation given a responsibility for the Ministry of Agriculture are well access safe, healthy, and diversified products. So the policy already incorporated and implemented. So effective implementation of the policy is increasing the availability of healthy diet within the country. And the other thing, following the UN food system, the Ethiopia developed their own food system roadmap. In that roadmap, there are 24 game-changing solutions clustered into 7 clusters. One cluster is increase the availability and accessibility of healthy, nutritious diets. Within the game-changing solution also it's mentioned. So, and one game-changing solution also focusing on the management part of the food safety part. So these are the game-changing solutions indicated, and this is the responsibility of the Ministry of Agriculture, and the food system led by the convener is the Ministry of Agriculture, and co-led by the Ministry of Health Minister. So we are on track to increase the availability and affordability of healthy and nutritious diet. And the other thing, the Ministry of Agriculture committed to implement different initiatives. One of the initiatives is Lemat Rufat, which is basket bounty. In English, maybe direct translation is difficult, but it says basket bounty. That is focused on the livestock product. That livestock product, especially in urban city, poultry production to increase the availability of egg and poultry meat, they are focusing on that one. And the other milk production, honey and fish. These are the initiatives led by the Prime Minister, including the Green Legacy. These are to increase the availability of the nutritious diet. The Green Legacy, previously, we are focusing only on the forest fruit plant only, but recently incorporated the fruit tree. These are one of the opportunity to increase the availability of nutritious and healthy diet within the Ministry of Agriculture. And we are working with the EPHI and the Ministry of Agriculture together, and FAO also with us to implement the food-based dietary guideline as Dawit presented today at 3 regions piloting the food-based dietary guideline. Whether it is effective or not, that recommendation is good or not. To test that one, we are starting to test at grassroots levels in 3 regions in good progress. When we are visiting that pilot project, it's in good position. Our future plan is scale up throughout the country, but the scaling up is not only practice at grassroots level, but through media and brochure pamphlets to distribute the short messages, which is the 11 key messages throughout the country. This is one of the key component. And also in a school feeding program, another program, which is we are interrelated with working with the Ministry of Education, the Ministry of Agriculture, because the garden, vegetable garden is one of the important and healthy diets and healthy food. To implement and to expand that one, we are working with Ministry of Education on the school garden program. So these are the healthy diet availability and increase within our country. All are culturally appropriate and acceptable. If it's beyond the culture, it's difficult to accept easily. So we are considering the cultural aspect. For instance, in southern region, they consume root crop most of the time. In northern part of Ethiopia, they focus on grains. So how to diverse there? How to healthy foods? So we are focusing on the available and locally and culturally acceptable food in that one. So these are our implementation experience, especially in Bahar Dar city. We are delivering training for different partners from different sectors. And in our city also, we invited from different sectors to participate in the food-based dietary guideline training. This training was delivered by not only Ministry of Agriculture in collaborate with EPHI together. We are working hand in hand because multi-sectoral is important. Malnutrition faces, it's not only by one sector solution. The problem is coming from different parts, so the solution coming from different sectors. So we are working together, especially the health sector and the Ministry of Agriculture. The role is high to reduce malnutrition. Without food, we cannot talk anything more because healthy diet is coming, the source is agriculture. The source is farmer. So maintaining and focusing on the agriculture sector is one of the crucial and the center point of our country, and our policy supports this one. And the food-based dietary guideline completely aligned with the Ethiopian food system and also rural agriculture policy. It's completely aligned both because the dietary guideline is focusing and leading on the food and also plus social behavioral change. So our extension workers are focusing on the social behavioral change. Without social behavioral change, availability is no change. So it's important to change the behavior of the community. So our experts are teaching at grassroots level also. These are some of policy supporters in our case. Thank you.
Alemtsehay, thank you so much for that wonderful overview of all of the many initiatives and the great level of coherence and integration between them across the sectors as well. So like it's really great to have that. It brings us all kind of up to speed on what your unit, but also with the different ministries and how they're working together within Ethiopia. So thank you so much. So next I'm going to go to Andrea. So Andrea from FAO. So Andrea, you lead the team that produces the annual State of Food and Agriculture report in the FAO. And the 2024 report, it focused on value-driven transformation of agri-food systems with a particular emphasis on the hidden cost of food and distributional issues. So I guess what are the kind of learnings from that? What are the key options and levers that were identified in the SOFA report in 2024 that could improve the affordability of a healthy diet for the billions of people who currently can't afford a healthy diet? And what do you think different actors can do to achieve the fastest results? So kind of your reflections, from the SOFA report, I guess. Over to you, Andrea.
Thank you, Charlie. So as you mentioned, the 2024 SOFA report analyzes the hidden costs of agri-food systems, including those associated with dietary risks, both linked to affordability of healthy diets, typically a big issue in low and middle income countries, but also other risks that are found in higher income countries. So it is a pretty diverse situation, and clearly the type of interventions that are advisable vary a lot by country. So I'll just point to two, right? In countries where affordability is a challenge, I mean, promoting inclusive economic development should be the objective. And I think Dawit's presentation on the wages linked a little bit to that. But this is kind of a long-term goal, right? And so in the short term, kind of nutrition-sensitive social protection programs can be quite effective in improving diets for more vulnerable. And that also was a point that David, I think, made. More generally, an area that the SOFA 2024 report emphasized and that is relevant across both low income, middle income, and high income countries is that of public procurement of food in schools, hospitals, and public institutions. One example, Brazil's food acquisition program is a large-scale public procurement program reported as an important source of healthy food for food insecure children, for example. And school meal programs can have significant influence over the way food is supplied and offer an opportunity to raise awareness and adjust consumption patterns. So they provide a healthy diet to those who can't afford it, but also provide examples of healthy diets to those who can afford it but may not be aware of it. And even tweaking existing school meal programs can provide gains. For example, the Rockefeller Foundation estimated a 250 million reduction in hidden costs associated with dietary risks just by substituting refined grains with fortified whole grains in school meal programs in Ghana, Kenya, and Rwanda. So these are just some examples of the type of interventions that come out of the SOFA report, which provides a broader perspective on potential interventions depending on the countries clearly. So over to you. Thank you.
Thanks so much, Andrea. And it's really great that you make the point about having to have tailored, context-specific options and portfolios of options that may be differing for different countries and even within countries, different contexts. Okay, so super that you made that point. So next, I'm gonna go over to Anna. And so, Anna, you've been a leading light in terms of the work in this area. You've worked at the intersection of agriculture, food systems, and nutrition for many years. So how do you think progress on food systems can best be measured, and what indicators can governments and other food systems actors use? So like your reflections on that.
Yeah, thank you very much for the question, the opportunity to be here. And Dawit, thank you for the excellent presentation on the findings of cost and affordability of a healthy diet in two cities. And I think that's a demonstration of the type of indicator that can be very useful for tracking change and transformation in food systems. I really want to recognize and commend the efforts of the Ministry of Agriculture, the EPHI, and even also the Ethiopian Statistical Service for this kind of whole of government approach to implementing food-based dietary guidelines. It is, as a person who has looked at dietary guidelines around the world, it is, I would say, a premier example and really pioneering as an approach to dietary guidelines, which have traditionally been used kind of for educating people on telling them what to eat. And here we have, had this discussion where Mrs. Sergawi, thank you for your remarks. You've outlined exactly what can be done in agriculture to help make it more possible for people to actually achieve the dietary guidelines by looking at increasing availability and accessibility of healthy diets that are recommended. And so that goes along with the SBCC efforts, not only to individuals to choose a healthy diet, but also to people who are growing food on choosing what to grow and transforming the food system in that way. So when we look at indicators, to your question, the indicators need to match the targets that are desirable for the outcomes of the food system. So access to healthy diets, the cost and affordability of healthy diets is one of the key indicators that can help track progress towards that target of everyone being able to access a healthy diet. Also, it would be important to track whether people are actually consuming the diets that are recommended. So tracking dietary quality and in addition, tracking the various factors in the food system that may be upstream of access and diet, as well as downstream, so nutritional status and health outcomes. And so a really nice way that this has been put together is in the food systems dashboard, and I will paste a link into the chat, but a kind of dashboard of indicators across the food system, and some of them can be identified as challenges in a particular country, and some of them may be going well. And to be able to look at that data to make evidence-based decisions on what is particularly in need of attention to help people access food, not just enough calories, but healthy food, as has been discussed. And a few of those indicators that have been compiled on the Food Systems Dashboard are selected within an initiative called the Food Systems Countdown Initiative. And this is a set of about 50 indicators across the food system, which have been identified by a large group of scientists working on food systems, and could be, they're offered as a set of indicators that could be particularly relevant for being able to track kind of across the whole food system, the challenges and the opportunities for improvement. So I'll put some of those links in the chat. And yeah, thanks again for this great conversation.
Thanks so much, Anna. And it's really great that firstly, it's great that the work that you and the colleagues are doing on the indicators and the food systems countdown and so forth. But it's really great that you also, highlight the importance of indicators of measurement of progress, that unless you measure it, it's difficult to know what is really happening. So that's really critical, and it's important those indicators can be accessible and available and measurable for all the actors in the food system. So I'm going to come back to Alemtsehay with another question. So this question relates to malnutrition in Ethiopia. So it consists of undernutrition, but also diets and lifestyles are leading to overweight and obesity, the double burden of malnutrition. So from your public health perspective, what do you see as the main challenges you see for overcoming both undernutrition and overnutrition in Ethiopia?
Thank you. One of the challenges is the economic way, that is the economic barrier of which is the purchasing power of the community. It's low because the nutrient dense compared to the cereal, the cost is higher. So that is one of the challenge, the status of the living standard of the community. And the other thing is limited access of nutritious diet, because the market linkage is not that much strong. Recently, the government work on that one to establish strong market linkage and digital market, and also to cold chain establishment. So one of the challenge is that is limited access diverse food, because it's far from the city. The main cities are the big cities are far from the rural community. It needs about transport, and the healthy diets are more expensive because it's perishable easily, rotten if it's not getting a proper packaging and proper transportation system. That is one of the challenge. So they are focusing on the communities are focusing to consume processed food and unhealthy food. That's why the double burden of malnutrition increase from time to time. And the other thing is lack of nutrition education. Most of the communities understand nutrition is cooking and eating. They said nutrition is science and it's art. So it needs about nutrition concern. It's a health issue. It's a concerning issue. But most of the time, nutrition, it's simple, they said. If food is available, we can cook and it consume. No problem, they said. So it needs about strong and passionate people need about to teach the community to change the behavior of how to utilize and how to consume and how to cook even. Because the cooking style also, if it's not properly cooked the food, they cannot get appropriate nutrient from that food. Only availability is not enough. So cooking method also important. So nutrition education, lack of nutrition education, proper nutrition education, one of the challenge for this problem. And the other thing is the climate change. It's up and down. Most of the time there is a drought, sometimes and flood. So the climate change also, it's difficult to increase the amount of the agricultural products, especially the nutrient dense, it's susceptible to pests and disease. So that is the challenge for that one. So they cannot, the urban city cannot get easily from rural community. That's why recently focusing on increasing production within around the home, vertical farming, and to produce their own consumption. We are pushing that one. The reason is this one. And the other, recently, there is a double burden. It's infectious disease linked to undernutrition in our country. That is non-communicable stunting. This is the consumption related. If they are not consumed properly, based on the dietary guideline, we lack so many things, the nutrient contents. So these are the challenges. And there is a poor regulatory system that is controlling food industries to limit the processed product is unhealthy products. So if the regulatory system is strong, they can produce the industry's healthy diet rather than delivering unhealthy diet. So this is one of the poor, it's not lack, but the poor regulatory system in our country. And there is a deeply to the traditional and social norm to influence dietary choices in our country. For instance, orange flash sweet potato is vitamin A enriched. If you are well within the city, they understand root crop is for poor people. They didn't understand about the nutrient. There's a deep rooted within our community, the consumption behavior, the poor choice. So it's related to the nutrition education and the consumption behavior that stick on one type of product or two type of food groups rather than diverse their tables, the plates. So these are some of the challenges to lead the community, children, and mothers to lead malnutrition and undernutrition. These are some of the challenges in our case. Thank you. It's over.
Thanks very much, Alemtsehay, and it's really great to kind of to indicate the multiple kind of challenges, but also the multiple possibilities into addressing those challenges. So I've got two more questions for Andrea and for Anna, and then we'll go to questions from the online audience. Okay, so question for Andrea is it's really about the reality that 70% of the world's population will be living in urban areas by 2050. And so in our research project, we consider that the dietary patterns of city regions will be critical to determining the environmental impact of our agri-food systems in terms of what is grown. And so what data and insights, Andrea, do you think can help city regions to shape sustainable agri-food systems?
Thank you, Charlie. So first of all, this is a very interesting and challenging question. I mean, it's at the intersection of two topics that I care a lot about because I've been working on city regions for a bit now. And I think the first step is delineating city regions. So what do we mean by city region? And very often I see that different people use it in different ways, depending on what issue we're looking at. Is it food? Is it employment? But at some point, if we want to have an evidence base, we need to agree on what city regions are. So it's important to delineate the confines of city regions when we think about our agri-food systems. The reason is that for our agri-food systems are often at a larger scale than city regions themselves. So how do city regions come together to shape our agri-food systems is important. So trade across city regions, but even between countries are key to sustainability and resilience. So thinking of city regions as standalone systems is really a bit of a non-starter. It is for this reason that it is necessary to first understand where one city region ends and another begins, where they overlap. And so to this end, in collaboration with the University of Twente in the Netherlands, we published an article in Nature Cities called Worldwide Delineation of Multi-Tier City Regions. That has a geospatial data set associated with that exactly delineates city regions based on travel time all over the world. And so it can be accessed. The data is in a public repository, and we're in the process of creating a web-based platform to make it easier to analyze the data. And overlay it with data on agri-food systems and economics. So, however, this was only the beginning of how we can take a city region, let's say territorial perspective, to improve the sustainability of our agri-food systems. The idea behind this data set is that it would be augmented by looking at, for example, mapping the infrastructure needed for proper functioning of agri-food systems within a city region. So, for example, let's say you want to reduce food losses. Where are the storage locations and the processing plants? How does that come together? And I think another aspect that is quite important that I find interesting in terms of the relationship between agri-food systems and city regions is how they contribute to agri-food systems sustainability, we also have to see whether people have access to healthy diets. So it comes back to the income generation that city regions provide. And so I think that part of delineation, it feeds into, okay, let's combine the data on how our agri-food systems function, where are the production areas, where is the processing, where is the storage, where are the income generation opportunities in rural areas and in the urban centers. And city regions very often have multiple urban centers. I mean, we often think of a city region as just one city, but in fact, this data set shows that city regions very often extend across multiple urban centers that provide different services, different employment opportunities. So I think this dimension is quite important when we think about sustainability, both environmental, but also economic and social. Thank you.
Thanks, Andrea, and thanks for the pointer towards the new data set that you've generated with the colleagues in the University of Twente. And like it clearly indicates that we shouldn't be looking at cities in isolation from the rural populations, that the interrelationship between these is really critical to future health but also future kind of sustainability. So last question from my side, from our side for Anna, before we go to some questions from the online audience, right? So Anna, you and others, you've recently done a global and a regional analysis of the availability of foods needed for health. And it's often said, we often hear that the world produces enough food. It's a statement. But is this statement really true at the global and regional levels? And what is necessary in your mind to ensure availability of food needed for health globally, regionally, and nationally?
Yeah, thanks a lot for that question, and I can be brief. The question you raised, the statement about the world produces enough food, is that really true? It is in terms of calories, but apparently not in terms of healthy diets. So I put a link in the chat to the paper that you referred to, the global analysis of food supply data, and comparing it to the needs for human consumption and dietary guidelines. And we see large shortfalls across the more nutrient-dense food groups, in particular in sub-Saharan Africa. The only food group that comes in as having an adequate supply for everyone in the population is starchy staples. So when we look at fruits, vegetables, animal source foods, legumes, nuts, and seeds, the availability is too low for everyone to follow the dietary guidelines on amounts to consume for health, including both, for nutrient adequacy and for protection against non-communicable disease. And so, again, emphasizing that simply trying to educate people to consume healthy diets will fall flat if we don't have efforts such as was described in the Ministry of Agriculture to ramp up production and availability, in addition to accessibility of the more perishable, more nutrient-dense foods that are needed for a healthy diet. So again, I really appreciate the efforts that are being made today that we've heard about. And in the paper, there's more information about supplies around the world. And one other point that came up in the chat, I think it's also possible that some of this food supply data does not fully take into account the indigenous and wild foods that may be available. So protecting people's access to wild food sources and to indigenous vegetables that may be harvested is also an important strategy to increasing access that might be missed in the official statistics.
Thanks very much, Anna. Okay, so what we're going to do now is we're going to move to some brief Q&A from our online audience. So please, if you're in the online audience, please write your questions in the chat, and if they relate to a particular speaker, please indicate who the question's directed to, and then I'll select some of these, and I've got to watch our time as well. I'll select some of these and then pose them to the speakers. But before we do that, we really want to at least to get some participation from our online audience in another way. So we've got two exercises that we'd like you to engage in. Kira, who's our comms officer, is going to has put on the screen how we're going to do this, right? So basically, we have a piece of software. If you have a phone, the QR code on the left that you can see on your screen, you can open that in your browser on your phone, and it will take you into an interactive questions that we'd like to get feedback from the audience on in relation to 2 questions that we're posing, right? Okay. Then if you don't have a phone and you're on a computer, you can just go to vivox.app and then put in the ID number of this particular exercise, and that will take you in there. So we'd invite our online audience to engage with this. It's basically we're asking you to, in one word, to say what is the most important topic, intervention or action that you think could increase the affordability of a healthy diet for city regions. So we'd like to hear from the audience in relation to that question, and we'll put up the results of that at the very end. And then we've listed a range of research topic areas that could be important for enabling affordable, healthy diets in city regions, and we'd like you to rank those. We'd like to hear from the online audience, what you consider to be priorities. So if you press the first one, it'll say priority 1, second one priority 2, and so forth. Okay, so highest priority would be the first one that you press. So we'd like you to engage with that in the background while we move to the Q&A, and we'll have a brief Q&A session with the speakers. We'll finish out because they've already answered a lot of questions, and then we'll come back and see what the results of that interactive survey is. Okay, this is a bit of an experiment for us, but let's see how it goes. Okay, so like what I'm going to do next is I'm going to just choose questions, and I'm sorry to anybody if we don't get to your question because we don't have enough time, I think. But we are going to write a report on this online webinar, which we'll send back to everybody, and everybody's questions will be reflected there. Okay, so Stacia, you ask a question now. What makes the cost of nutrient-dense foods higher? Are the staples subsidized? And I don't know, Alemtsehay, would you have any views on whether nutrient-dense foods are higher in cost and what's making them more expensive if that's the case? If you're there, Alemtsehay.
One is nutrient-dense productivity compared to staple food. It's low. And the other thing, the input is difficult easily to get for that one. That's why. And also it's labor intensive to produce. Farmers easily produce staples, and the productivity per hectare is higher than the nutrient-dense crops. That's why. And the nutrient-dense crop are most of the time it's susceptible to disease and pests. So it needs about chemical, so many things. That's why the cost is different from the staple. And the other, the land coverage is focus on the staple crops rather than the nutrient-dense. That's why the cost of both compared to the cost, it's higher than that one. For instance, in urban city at this moment, in urban cities, especially in Addis, they engaged poultry farm. Previously, only the farmers are producing egg production, but now urban cities, big urban cities are urban agriculture, because in our ministry, it's already established the urban agriculture directorate, so they are giving emphasis. But even the feed part is coming from the staple crops, so they cannot feed it properly for poultry, and the cost is compared to staple crops, it's expensive. Maybe that's all. Thank you.
Okay, that's really super. Okay, so I have a question here from Una Murray, and it comes from, I think, more the kind of climate change processes that are underway internationally and nationally and regionally. And so I'm going to pose this question to you, Anna, and I don't know if you have the answer or not, but let's try. So with regards to climate change initiatives more broadly, Una's wondering how strongly nutrition features in the BELEM work program on indicators under proposed food and agriculture indicators that are being spun up, let's say, on the climate processes side.
Could you repeat who that question was to?
Yeah, absolutely, no problem. So Una's question is to what extent there's a BELEM set of indicators, process for making indicators, I think in relation to climate change adaptation within the UNFCCC process, the Framework Convention on Climate Change. And Una's wondering to what extent nutrition is being integrated within the food and agriculture indicators in that indicator set. Yeah, I think that's the idea.
Was that for me?
Yeah. Yeah.
Oh,
Yeah,
sorry. I
okay.
don't have any detailed information on that
Okay, no,
framework.
that's fine. No problem at all. Don't worry. So then I'll just choose another question. I'm going to try and get one question for everybody. So for Dawit, it's a question that's coming from Alemayehu. So it's what percentage of our income does a household typically spend on the cost of a healthy diet? So that was what percentage. Would you have any kind of approximate answers to that? Dawit, on your side.
Thank you.
It can be a range. Yeah.
It's a good question. On average, it's between the two cities, the incomes are, between 214 and 169. So out of those incomes, almost, for example, 60 Ethiopian birr is spent on food, let alone non-food items. So I think it's better to first define food and non-food costs first.
Okay.
I remember, according to HISIS 2016, it's between 47 and 53 non-food to food ratio from the 100%. For 53 for non-food items and 47 is for food items. So it's simple to calculate that from the food expenditure, we can estimate, how much is 60 over maybe half of the 2000. I mean the 214 Ethiopian birr for Bahar Dar and 169 Ethiopian birr per day for Hawassa. So it's a proportion kind. Yeah, we can put the proportions from their incomes.
Okay, and just a related question as well. This question was from, if I can see here, from Stacey, I think. Yeah, it's like, so what percentage of foods would come from markets versus what would come from community or home agriculture? That portion, because I think that would also inform people's understanding of where people are accessing food from.
Yeah. Actually, I don't have recent data, but the national estimates by EPHI, the latest one is almost majority of the foods come from own productions and market. I can't give you I can't remember the correct figures, but
no, that's fine. That's okay.
Majority are from own production, and then from market, and then from aids and other sources, gifts and other sources.
Okay, and then just thanks very much, Dawit. Last question for Andrea. There's a question in the chat, Andrea, which is really about in the situations where there's a currency devaluation, then and the impacts that could have on affordability of a healthy diet. What would be the kind of options that could be available to try and ensure availability of a healthy diet during the periods of a currency devaluation? I don't know if that's a very tricky question or not, but you're an economist, so I thought I'd pass it to you.
Is
it for Dawit or for?
No, it's for Andrea. Yeah.
Oh, sorry.
But you're welcome to answer, Dawit. No, I think a big part of it is depends on where food is coming from when you experience a devaluation, right? So in a country that produces its own food, the devaluation affects farmers to the extent that they are an exporting country of agricultural goods, and that can have an impact on people's incomes and therefore on also on their ability to access a healthy diet. Where it really hits is instead is if it's a country that mostly imports foods, then food becomes a lot more expensive, and that's where social protection programs have to kick in for the more vulnerable, essentially. One thing I wanted to answer that was in the in the chat is about the where the food insecure are. That there's a comment that says that FAO documents indicate that overall it's rural people who are food insecure. I think the city regions perspective is interesting because it gets away from this urban rural, right? Because rural can mean many different things, right? And I think putting things in context in city regions really provides that extra information. So, for example, the high-level panel of experts produced in 2024 a report on urbanization, and they came out that 1.7 billion people, 3 out of 4 food insecure, are in urban and peri-urban areas. So the peri-urban areas often are classified as rural, but in fact, I mean, we think of rural as somewhere off in the distance, but it's not. So I think that's why I particularly appreciate your take, your project on the kind of city regions perspective and the work that Dawit presented. Thank you.
Thanks very much, Andrea. And so I think we're going to stop the Q&A session there because I realize we're running slightly over time. So at that, I'm going to go to, so hopefully we have some responses from the exercise, our online exercise. So I think I'm going to ask Kira if she can pop that on the screen and we could just see what our online audience thought in terms of like what are priorities. So this was like in response to the simple question in one word, what's the most important topic, intervention, or action that could increase the affordability of a healthy diet for city regions? And the wisdom of our online audience indicates that really policy and education stand out there. So that's one worth considering, but there's many others in there as well that I think are for kind of an enriched debate. And so on the second piece, if you can go to that, Kira, if that's possible. This was really an exercise of trying to rank what would be research topics that are most important to advance if we want to enable affordable, healthy diets in city regions. And again, policies and regulations comes out on top. Nutrition literacy and education comes out second. And again, that's consistent with the word cloud. Economic barriers next, supply chain challenges, and so forth. They're clearly all important, but some are perceived as more, by at least the poll of our online audience, as being more important than others. And that's kind of valuable for our project, but I think it's also valuable for everybody else in terms of where to focus kind of efforts. So I think at that, I'm going to say thank you to everybody for the quite enriching and detailed kind of discussion. Thanks to Dawit for his wonderful presentation. Thanks to our esteemed panelists for all your comments and responses to the questions, and also really for educating us, I think, on the challenges, but also the opportunities in relation to affordable, healthy diets. But also, last but not least, to our online audience for engaging with this. Sorry that everybody didn't get their questions asked, but what we're going to try and do with this is we're going to try and write up a report just on the webinar itself. We'll circulate it to everybody. We have records of everybody that's here, and we'd really like to try and help people kind of network and connect with each other in relation to this topic, which is not going away. So thank you all for a wonderful webinar, and hope you have a lovely day.